Welcome to all of the attendees who are joining us in this session. This is the Risk and Protective Factor, COVID-19 Findings and Novel Approaches to Firearm Research abstract session. Thanks for joining us. We're really glad that you're here. As a reminder to all of the attendees, this session is being recorded and only the presenters and the moderators will be visible. The chat function in Zoom is disabled, so please do use the Q&A function for all of your questions. If you have a question for our presenters, please ask it by typing it in the Q&A feature located at the bottom of your menu bar at any time. And I would encourage you to do that throughout the presentation as we are collecting those questions behind the scenes in order to ask them of our presenters at the end. A live transcript is also available for this session for accessibility. If you prefer to hide that, please click the up arrow next to the transcript button and select Hide Transcript. Now, please join me in welcoming our abstract presenters. We have Kelly O'Connor, who is a doctoral candidate at the Virginia Commonwealth University in clinical psychology. We have Dr. Stephanie Bonne, who is an associate professor of surgery and the trauma medical director with the Rutgers, New Jersey Medical School. We have Amanda Aubel, who is a research data analyst with the University of California Davis Violence Prevention Research Program. We have Whitney Orji, who is a medical student with the University of Pennsylvania School of Medicine. We have Dr. Daniel Semenza, who is an assistant professor with the Department of Sociology, Anthropology, and Criminal Justice at Rutgers University in Camden. We have Dr. Michelle Degli Esposti, who is a postdoctoral research fellow with the Department of Social Policy and Intervention at the University of Oxford. And we have Dr. Jason Goldstick, who is a research associate professor with the Department of Emergency Medicine here at Michigan Medicine. All right, we will get this session started and we'll begin sharing presentations.
Hi, everyone. Thank you so much for joining us today. So I'm just going to jump right into things. So although previous research has identified risk factors for adolescent handgun carriage, we know much less about protective factors. So to address this gap, my colleagues and I examined several risk and protective factors for adolescent handgun carriage. Next slide, please. We conducted secondary data analysis with a predominantly African-American sample of adolescents in 3 urban economically disadvantaged communities. And these data were collected as a part of an ongoing CDC-funded study that's evaluating a community-level approach to youth violence prevention. So we used several different self-report measures of hypothesized risk and protective factors for adolescents' handgun carriage in the past 3 months. And moderation analyses were conducted using SPSS process macro, and all analyses controlled for demographic characteristics and violent victimization. Next slide, please. We found that both constructive use of time and support mitigated the effects of gang involvement on handgun carriage, but only for adolescents who endorse gang involvement. So as you can see from the figure, those who were not involved in the gang had a very low probability of endorsing handgun carriage. Contrary to hypotheses, we did not find any interaction effects for positive outlook or interaction with pro-social friends. Next slide, please. In models with friends' problem behavior as the risk factor, we again found that constructive use of time mitigated risk, but only for adolescents whose friends engaged in higher levels of problem behavior. We also found that friends' problem behavior was associated with a higher probability of handgun carriage regardless of adolescents' level of support. However, the association between friends' problem behavior and handgun carriage was stronger at lower levels of support. Again, we didn't find any evidence of protective effects for positive outlook or interaction with pro-social friends. Next slide, please. In models with handgun access as the risk factor, the only significant interaction effect was with positive outlook. So specifically, our findings suggest that positive outlook is only protective against handgun carriage when adolescents perceive less access to handguns. Next slide, please. So some notable limitations of this study include the use of cross-sectional data, reliance on self-report. We also had some low power for small effects, to detect small effects. But despite these limitations, our study adds to the literature by not only identifying strengths and developmental assets of adolescents in high-burden urban communities, but also by combating the deficit or risk-oriented narrative that's often perpetuated in the literature. Overall, our findings suggest that enhancing adolescents' constructive use of time, sense of support, and positive outlook might be important targets for prevention efforts. Thank you.
Hello, I am Stephanie Bonne, and I am from Rutgers, New Jersey Medical School in Newark, New Jersey. I'm not sure why my video is not working, but we'll just go with it. So this is a study on the risk factors for, there we go, the risk factors and survival disparity of firearm violence against women, and was performed by myself and a number of co-collaborators. Next slide. So we know that women represent nearly 15% of all annual firearm fatalities, and it's well described that there's an increased risk of firearm violence in the setting of intimate partner violence, but intimate partner violence is not the only cause of firearm violence against women. This study was looking at the trends and demographics and circumstances following female gunshot wound admissions. We obtained all women who were admitted to a trauma center or seen in the emergency room of a trauma center from 5 urban trauma registries from 2012 to 2016. We then did an individual chart review for each patient to abstract the demographics, the outcome, and the narrative circumstances related to the shooting. For the corresponding states in which these trauma centers were located, the CDC Whiskers dataset was then queried also to obtain the firearm deaths during the study period and separated by gender, which gave us essentially sort of a case fatality sample. Next slide, please. Women represented 10% of all the gunshot wound victims in our study. There was an increasing number of total female firearm injuries over time. However, the percentage remained about steady at 10%. So just the denominator of total gunshot wounds was going up in these 5 states. Gunshot wound intent was classified as either an assault, undetermined, unintentional, self-harm, or legal intervention, and about half were assaults. 26% of all of the incidents occurred inside or around the home, but only 5% were documented in the medical chart to be intimate partner violence related. And about a quarter of the incidents had no data or no mention of whether it was IPV or not. Females accounted for about 10% of all patients that were transported to trauma centers, but 15% of the statewide deaths, representing a gender disparity in the survival of firearm injury. And women had a significantly higher in-hospital mortality rate than men. Next slide, please. In summary, over a quarter of women are shot in their home, but the reported rates of intimate partner violence are low. This can be due to poor screening and reporting, excessive pre-hospital mortality related to compared to men, and the rate of missing data regarding causation is very high in the medical charts. There's disparities in the survival of female firearms victims compared to men, both before and after arrival to a trauma center, suggesting likely more serious injuries or more being shot more times. And the majority of women who are gunshot wound victims are actually non-IPV assaults, which demonstrates the need to include women in projects like violence intervention programs. Thank you.
All right, hi everyone. My name is Amanda Aubel, and I'm going to be presenting some timely data on the intersection of violence, firearms, and COVID-19. Next slide, please. The data I'm presenting come from the California Safety and Wellbeing Survey, which is an ongoing state representative survey of California adults developed by our research group. The first wave of the survey was administered in 2018, and the second wave, which included questions about the coronavirus pandemic, was just administered in July of this year. I'll focus on 2 research questions. The first is, how have concerns about violence changed since the coronavirus epidemic began? And the second is, has the coronavirus epidemic prompted people to buy ammunition, acquire guns, and/or change their storage practices? And if so, why? I'll also emphasize the findings among our respondents who live in households with children, which is about 1/3 of our sample. Next slide, please. So to answer the first research question, we asked respondents how worried they were about different types of violence happening to them before and now during the coronavirus epidemic. If you go to next. If you look at the very worried bars, you'll see that for these 4 types of violence, assault, police violence, robbery, and stray bullet shootings, the percentage of respondents who said they were very worried significantly increased during the coronavirus epidemic. Next. In contrast, there was no significant change in those who said they were very worried about mass shootings, suicide, or accidental shootings before versus during the coronavirus. And there was a marginally significant increase in worry about homicide. Next, please. I'm going to skip this, so go next. Great. So for the second research question about gun purchasing, about 15% of our total samples said that they personally owned a firearm. And among firearm owners, 8.5% said they bought ammunition in response to the coronavirus epidemic. And about a quarter of those individuals also acquired a firearm. Among those who got a firearm, about half said they did not already own a gun at the time. Next. 45% of people who bought ammunition and 74% of those who acquired firearms live in households with children. Next, and one more next. And extrapolating these results to the adult population of California, we estimate that more than 100,000 people acquired guns in response to the coronavirus epidemic, about 50,000 of whom did not already own a gun. Next. The top reasons cited for buying ammunition and guns were related to concerns about safety and self-protection, including being worried about lawlessness, prisoner releases, government collapse, and the government going too far. Next. I'm gonna skip this slide, go to the next one. One more. And then this, lastly, in terms of firearm storage, most gun owners reported storing their firearms in the most secure way, where all guns are unloaded and locked up. But 18% reported storing at least one gun loaded and not locked up, and 7% of those individuals said they had switched from a more to less secure storage manner in response to the coronavirus epidemic. Among those respondents in households with kids and guns, 90% claimed a child could not get access to a gun stored at their home without their knowledge. Even gun owners who don't store their guns, all unloaded and locked up. And we know from past research that this is often an incorrect assumption. Next. So in summary, this is the first population-weighted survey to our knowledge to examine the intersection of COVID-19, violence, and self-reported gun purchasing. We found that people's concerns about intentional interpersonal violence increased during the coronavirus, and this could be linked with worries about police violence and protests that are happening concurrently. A large number of people reported acquiring guns and switching to less secure storage practices, probably to better protect themselves, but these changes can threaten the safety of children and others in the home. And more broadly, we can begin to think about how large social and economic shocks affect the same underlying factors that increase violence and how we might address these factors. Thank you.
Hi, everyone. Good afternoon. My name is Whitney Orji, and on behalf of my team from the University of Pennsylvania, I'll be presenting our findings on youth firearm assault in Philadelphia during the COVID-19 shutdown. Next slide, please. So the purpose of this investigation was to describe the impact of the COVID-19 shutdown on firearm assaults of youth in Philadelphia. We used publicly available Philadelphia Police Department data to identify victims of firearm assault between 2015 and the present. We identified youth as those who were less than 21 years old and compared incidents in the past 5 months since the governor's stay-at-home order was issued to incidents in the preceding 5 months and in the same 5-month period in 2019. Of note, at this time, the stay-at-home order has since been relaxed to a safer-at-home order, with many businesses starting to open up again. Next slide, please. We found that 197 of the roughly 415,000 youth in Philadelphia were shot during the period in question, compared to 125 in the prior 5 months and 123 in the same time period the previous year. Youth comprised about 20% of victims, which was stable from the other time periods in question. And 93% of the youth victims were Black, 11.2% of the victims were girls, and 10% of the shootings were fatal. Again, these were similar to proportions in the prior periods. The graphs to the left show in green the counts and in blue the proportion of shootings involving youth in these 3 time periods, with the first bar representing the 5 months of shutdown in question. They show the increased absolute number but stable proportion of youth shootings during this time. Next slide, please. So although prevention measures, including stay-at-home orders, might be expected to reduce conflict that can lead to firearm assaults, youth shootings actually increased in absolute number in the first 5 months of the shutdown in Philadelphia, with over 50% more youth experiencing firearm assault in those months than compared to the preceding 5 months or the same time period a year prior. These firearm assaults continue to disproportionately affect Black men and boys. And reasons for this could possibly be shutdown-associated reductions in social support, in positive neighborhood activity, and economic opportunity, along with increase in stressors such as school closures and financial instability that can contribute to these interpersonal dynamics. That's it. Thank you.
Not sure if my video is showing. I'm not seeing it, but it's okay if it's not. So my name is Dan Semenza. I'm at Rutgers University, and I just want to shout out to my co-authors, Richard Stansfield and Trent Steedley, who is at University of Denver. Glad to see in the chat that I'm still on. And the title of the paper, which is currently under review, is Firearm Availability, Violent Crime in the Context of Structural Disadvantage in the US. Next slide. So the two research questions that we had was, how do legal and illegal firearm availability predict subsequent rates of firearm and non-firearm homicide in American cities? And how does city-level economic disadvantage condition this relationship? So we're trying to get at this availability violence question by complicating it a bit and looking at different types of availability, while also looking at how this differs by disadvantage across cities. And so the way that we do this is my co-authors and I combined a bunch of different data sources from the UCR, from the great data people at the Trace and their missing pieces data collection, the American Community Survey and the ATF, and we use random effects models to estimate the associations between the different types of availability, which show the measurements on this slide, and rates of homicide, both firearm and non, across 226 cities from 2010 throughout 2017. Next slide, please. And so the results, we have kind of four main results that we found in the study. The first is that the prevalence of illegal guns, those that were reported lost or stolen in cities, predicts future rates of firearm homicide. But conversely, what we find is that the rate of legal firearms through firearm dealers does not significantly influence firearm homicide, regardless of the dealer type. Third, we find that the association between illegal availability and homicide is conditional upon high levels of structural economic disadvantage across cities. So essentially, we're really only seeing this kind of illegal effect when we're looking at low economic advantage, disadvantaged cities. And finally, in some ancillary analysis, we found that the rate of certain types of legal firearm dealers, big box dealers in particular, actually influenced the prevalence of illegal firearms in subsequent years. Next slide. And so this is just a quick interaction graph to show that when we're looking at different levels of advantage, we're really seeing this effect of a legal firearm availability on firearm homicide in subsequent years when we're talking about high concentrated disadvantaged cities. Next slide. And so the implications are to really take a look further at supply side interventions with a focus on different types of underground gun brokers, straw purchasing, as well as delinquent firearm dealers, especially in disadvantaged locales. And then, of course, I'm sure you guys have heard many times throughout the day to enhance data collection and transparency. With this in mind, establishing a gun ownership registry and improving measurement specifically of non-fatal incidents. So thank you very much. That's it for me.
Hi guys, thank you for inviting me. I will be talking today about synthetic controls and whether they can be used to improve firearm research. Next slide, please. One of the problems with firearm research, as we all know, when we're assessing things like policies, is that we don't have these tools available like randomized control trials due to ethical reasons. As a result, we tend to rely on quasi-experimental methods such as interrupted time series analysis or difference in difference designs. One of the things that's increasingly recommended is using synthetic controls to improve these designs. Next, please. I think we've got old slides up here, so I'm going to go next, great. So I'll just be talking a bit how when they are problematic and when using synthetic controls in interrupted time series analysis would be beneficial. Next, please. So just a whistle-stop tour, one of what interrupted time series analysis uses is pre-intervention characteristics to project in the outcome, to project what would have happened in the absence of the intervention. The main threat to this validity is that something else happened at the same time as your intervention, say a firearm law passed or regulation, increase that threatens the validity of this design. Synthetic control, meanwhile, is also designed on the pre-intervention characteristics, but is used to address the parallel trends assumption. So the idea is to match a control series with the intervention. We have old slides. Next, please. Next. Thank you. Next. So just to reiterate that, with the interrupted time series, one of the problems is something called history of bias. So something happened at the same time as the intervention, this other event which threatens the validity. When synthetic control might be helpful is that if you are pooling from a donor pool, so say if your case example is Florida and you have across the whole of the US, if that other event is hypothesized, such as an economic recession or coronavirus, is distributed equally, and then synthetic control might be useful. What might be problematic is that if it theoretically happens in state-specific places like a hurricane and only affects, say, California, and therefore synthetic control won't be able to capture that. Next, please. Next. Great, so this is just a quick example to show that actually when we use this to look at synthetic controls and using ITS in an example of evaluating stand your ground laws, which is an expansion to self-defense, and how that impacts homicides. What we did is we artificially imposed another event, a confounding history bias, and the top shows that if you case select those states like California with a hurricane, that you can capture that confounding event and counteract it with a difference in difference design. However, with synthetic control, as you can see, although it matches on the pre-intervention characteristics really well, adjusting the parallel trends assumption, it doesn't capture that artificial confounding event, and so doesn't improve causal influence. Next, please. So in summary, synthetic controls may be used to improve designs such as interrupted time series studies. However, we have to think really theoretically about what is the main threat to our validity in our study design, and not just to revert to using blind methods such as synthetic control as a default method to account for these things. When we're talking about using synthetic controls with ITS, we should really think about what other events might be happening at the same time eventually that threaten the validity of this design. Right, that's all for me. Thank you.
Okay, I think I'm on camera. I'm Jason Goldstick from the University of Michigan. I'll be talking about a model-based approach to determining the effects of a hypothetical community-based intervention for firearm violence. Next slide, please. So for those who aren't familiar, agent-based models are models whereby autonomous agents their actions are simulated according to a set of simple rules, and then feedback is produced within the model from those autonomous agents, and that leads to evolution of the entire system. And that evolution is used to study hypothetical outcomes that may not be feasible in practice, such as comparing a bunch of hypothetical interventions to one another, which is what I'm doing. So just to give a little information about the model formulation, this simulation occurs in a city that mirrors Flint, Michigan. The agent characteristics and place-based things like alcohol outlets, property conditions, and crime locations are from either public data sources or from data from the University of Michigan Youth Violence Prevention Center. So the basic mechanism in the model is that incidents occur when there's a victim, an aggressor, and an opportunity coalescing together. For those familiar with criminological research, that's basically routine activities theory. And and the individual victimization and aggression probabilities are based on the agent characteristics and published associations, and the opportunity level is based on the property condition and alcohol outlets and other things in that pixel. So as I said, a key element of ADBMs is feedback, and in this model that happens in two ways. One is through social space, because there is a social network underlying this simulation, and so social connections have reciprocal effects on one another, and in physical space, where if an incident occurs in a pixel, then the perceived opportunity level of that pixel increases at a future time step, so that there's more likely for there to be incidents in that pixel at a later time. So so basically we calibrate that to the real data and then simulate some counterfactuals. Next slide, please. So the first counterfactual is on the left here. This is a universal greening program where, as a function of the greening intensity, which I'm defining as the % increase in the property condition of every pixel, you can see there's basically a linear dose response there. And if you improve every pixel in the entire city by 50%, you can expect to see about a 1/3 reduction in firearm violence. But universal greening is probably not practical. So a couple more targeted approaches are shown on the right here. One would be, the first one says, for example, if you green just the bottom decile of pixels, then you might expect to see an 18% reduction across the city. On the other hand, if you just greened areas that had an incident in the prior year, then you might see an 11% reduction, and that would be about 3% of the city falls into that category. So that might be the most efficient way to do this. Next slide, please. So the bottom line, I guess, is that you can simulate firearm violence in Flint in pretty simple ABM that can be pretty accurately calibrated, which I wasn't able to show you. And that the most efficient way to green the area might be just greening areas that had incidents in the recent past. Some next steps on this are to simulate firearm policies such as cap laws and purchase age restrictions, and to incorporate cost effectiveness analysis to compare a set of interventions in terms of which is the most cost effective. And that's it. Thanks.
Great. So it was great to hear from all of our presenters, and we do have time for question and answer. So I would encourage folks who are part of the session to put their questions into the Q&A function. As the speakers turn on their cameras here, we can start to ask a few questions. So Dr. Bonne, I think the first question is for you. You alluded to the fact that we don't do a very good job of IPV screening, and I wonder if you've got thoughts or want to opine on how we improve that and how we do better.
Yeah, so I mean, I think this is like it's a training issue, and it's quite frankly in a lot of places is a capacity issue. I mean, our emergency room in my center has a 5% completion rate for screening for IPV in the emergency department among people who are indicated for screening. So it's like ridiculously low. And even when you are screening, like for example, it's like a really high rate in OB, right? In labor and delivery, like 96% of all patients are screened, but how are they doing the screening, right? So like if I'm a nurse and I'm in the electronic medical record and I'm going, do you feel safe at home? Like who's going to say yes to that? So it's I think also a training issue that, you know, it needs to be done in a meaningful way.
Training on how to do better, and then how to do it more, and yeah. So certainly an area of future research. Thank you. That was helpful. So Whitney, I think the next question is for you. You talked a little bit about the challenges of COVID and the impact of that, obviously, on firearm assaults. I'm curious to see. I mean, we've seen a lot of increased use of telehealth in the medical field, and we've seen a lot of virtual formats. Obviously, today is a virtual conference, and I wonder if there's ways of taking advantage of some of these formats and some of the programs that you talked about not being able to operate in their normal ways, and if you've seen any of that or have thoughts about that, or ways that we can capitalize on some of these newer technologies.
Yeah, I mean, I can't speak directly to what some of these programs are doing necessarily. I don't know if they've, adapted to the virtual setting or not. I'm sure some of them have. But I mean, I can imagine that might be a good way to sort of reinforce some of the social support that might have been lost during this time. I do wonder with that, though, if some of these populations that are most affected by gun violence may be similar to populations that, for example, have less access to like internet or computers, which we've seen has been an issue in terms of like education and public education in Philadelphia included. I wonder how possible that is, but I mean, I think it's definitely something that could potentially be done.
Yeah, I mean, thinking about ways we can both increase access as well as take advantage of the virtual format. Yeah, thank you for that. Jason, the next question was for you about in your model, how you simulated firearm carriage.
Oh, good question. So that was actually one of the hardest parts of it because, there's not really good data on that, motives for carrying and prevalence and everything. So basically, the way I did that is just try to make it make sense to me. So, so I thought, basically, 22% of the agents, I think, or something like that, had, or I can't remember exactly, but some percent based on a national survey had owned a firearm. And then your probability of carrying at a given time was based on how many of your social connections owned a firearm, so something about your social norms, and also was related to if you lived in an area where there were more incidents in the past year, so then you might have more of a perceived need to carry it for protection. So it was really a combination of both your social norms and also the social norms you're exposed to in your network, as well as your perceived need to carry, and based on where you lived. So it was kind of that's another element I didn't really get into about how the feedback in the model occurs through both social and physical space.
Very interesting.
Yep.
Thank you. And Amanda, I think the next question is for you. So I was struck a little bit by the differences that you saw in California versus some of the things that we saw in the last presentation around the national surveys that were presented. And I'm curious how you think that what you're seeing in California sort of squares up with sort of some of these national findings, and whether or not you've got thoughts about that.
Yeah, I think, California being one of the largest states and one of the most diverse states, a lot of the findings in our California specific survey can generalize to other parts of the US. And generally our findings about gun purchasing in response to the coronavirus do line up with other research of background checks and increased firearm injuries in the time of the coronavirus. And also it seems with the national survey from the Facts Group that found that a good number of parents reported purchasing guns in this time. Our survey has the additional advantage of asking respondents specifically whether they bought firearms in response to coronavirus. So this isn't just an association of firearm purchasing during this time, but the respondents themselves actually attributed their purchasing of guns and ammunition and changes in storage practices to reasons related to the coronavirus.
Interesting. Daniel, you talked a lot about the potential implications. I'm curious your thoughts on how the work that you presented could inform reduction efforts or policies. You talked a little bit about supply side interventions. I'm curious if you want to expand on that a little bit.
Yeah, that's a great question. So because we're looking at proxies, for sure of legal and, illegal access, or at least, illicit access, so to speak. What we really kind of take away is that the firearms are not necessarily being, or not necessarily correspondent, that are coming from legal channels, but they're coming much more from being reported lost or stolen. And so we think that if we're talking about supply side intervention, you know, obviously you have to focus on the delinquent suppliers, potentially suppliers where there are thefts that are occurring that are feeding into underground channels. But that seems to be almost secondary to, you know, doing work that targets either Anthony Braga and his work talks about kind of targeting large sellers and that are kind of having, you know, a bigger impact, but also some of these smaller transactions and kind of one-off sales and things like that. And we think that that has to be more important than thinking about necessarily the delinquent suppliers, but that can't necessarily be forgotten either. So we see it as kind of a balanced approach with a bit more emphasis on the underground or the illicit supply.
Really interesting. Thank you. I think I have time for maybe one more quick question here. And Amanda, I'm curious, you talked a lot about protective factors. I'm sorry, Kelly, you talked a lot about protective factors in your presentation. Thoughts about how that can inform, you know, future intervention efforts.
Yeah. I mean, I think that there needs to be more work done in ideally larger samples and longitudinal data, examining protective factors and also promotive factors. So what factors, if you have, if you have friends who engage in prosocial behavior, does that prevent them from carrying a handgun? So we need more research on this in wider samples and longitudinal data. But also I think that this can be used to inform existing efforts, which are trying to bolster positive development and youth violence prevention of the prevention of other adolescent problem and risky behaviors. Some things that our findings suggest that things like more after school activities, sports, opportunities for pro-social engagement are really critical for adolescents in high burden urban communities. And in our sample, actually, I was thinking about this, one of our communities is more isolated than the other communities, so they have less access to resources. So I actually might look at whether or not that the moderation effects that I found are significant within that community as well. So
really important to focus on those promotive factors and positive factors. And so really great that you were highlighting that work. I do think we need to wrap up the session. I want to thank all of the speakers for presenting their work. It was a great session.